This is for discussion 2, Ashford University HCA 322. My name is Rose, and I find in favor of the plaintiff represented by Cinnamon Chamber. The defendant, Dr. Clinician, represented by Paul Hansen, failed to demonstrate compliance under the Health Insurance, Portability, and Accountability Act. He failed to protect the patient's personal information and also failed to obtain written consent form from the patient or the legal representative, such as the surrogate. According to the text, confidentiality refers to the ethical and legal obligations to refrain from sharing information about other people without their authorization. There should be absolutely no information used in regards to the patient's case without written consent. In the defendant's initial discussion, he did not mention if he protected the patient's personal information, such as name, social security, date of birth, patient's identification number, and the diagnosis of the patient. So in this case, the defendant is guilty for violating the HIPAA regulation. According to the Privacy Act of 1974, no agency shall disclose any record which is contained in a system of records by any means of communication to any person or to another agency, except pursuant to a written request by or with the written consent of the individual to whom the record pertains, unless disclosure of the record would be list of exemptions. In this case, Dr. Clinician, once again, did not obtain written requests from the patient or the surrogate. Therefore, we find him guilty.